Welcome to Samba Samba. Enjoy the video.
You begin by replacing lost fluids and electrolytes right now. Mix an oral rehydration solution exactly as directed and sip small amounts frequently. This restores sodium and glucose needed for absorption. Once you can tolerate sips, increase volume steadily. Avoid sports drinks, soda, and juice because excess sugar can draw water into the gut and worsen loose motion. If vomiting forces you to pause solids, continue tiny sips every 5 to 10 minutes until vomiting subsides, then progress to light, clear fluids. Once rehydration is underway, shift to foods and measures that reduce stool volume and support recovery. Move through the BRAT progression: bananas, rice, applesauce, toast, because these foods are binding and low in fermentable sugars. Make sure you only consider loperamide if there is no blood, high fever, or severe abdominal pain, and you are over age 12. It slows transit and reduces frequency. In children and some adults, zinc supplementation shortens duration by supporting mucosal repair. Continue for the recommended course. You complete recovery by gradually reintroducing a normal balanced diet, small protein portions, cooked vegetables, and probiotics to restore flora, while monitoring output and urine frequency. Make sure to watch for red flags: persistent high fever, bloody stools, dizziness, faintness, decreased urine, or symptoms lasting beyond 48 hours. Those require urgent evaluation. If rehydration and simple measures fail, arrange stool testing so clinicians can target therapy. Certain bacterial infections respond to specific antibiotics.
Thanks for watching. Consider subscribing if we helped you.